Anesthesia can cause complications in upwards of 60% of patients. And being able to identify those issues before they ever come to fruition, that's what we do. We are one of the first interactions with patients when they're scheduling their surgeries. So they're talking with our nursing staff, going through their health history, identifying potential issues that could complicate their anesthetic process.
And with each case, we're trying to individualize care for each patient. So depending on the surgery, meeting the needs for the surgeon, but also meeting the needs of the patient and then their families.
I put them to the test of giving them some of the most challenging patients that they could have, and they've always stepped up amazingly.
I mean, really up there among the best I've ever worked with. I was really impressed. I've worked at a number of other places, and there's a few individuals that stand out in those other places, but as a consistent team here, I'd say the best.
Flattered and honored that they feel that way about us, because I think they are the best team I've worked with, and it's great to hear that they feel the same way about our team.
It means a lot, especially for these docs that have worked all over the United States to come here to Fairbanks, Alaska and have that type of environment that we can provide. It's quite humbling.
You know, it's a personality thing. I think it's a Fairbanks thing. You know, it's kind of one of the things I've just found in being here is that everybody steps up and they do their role, but they don't limit it to that role.
Everything we do here is patient-focused. Ultrasound IV is a new program that we're instituting here by training our staff to be able to insert IVs without doing what you'd call a blind stick. Ultrasound lets us see those veins popping up on a screen, and then we can actually see the needle getting fed into the vein, and we make sure that we're right in the correct spot without having to dig or fish around in someone's arm. Patients love it. It makes it a lot easier on them because we usually are much more successful at getting an ultrasound IV right off the bat.
Massive transfusion occurs when there is a trauma. Patients are losing blood faster than they can tolerate. Vital signs change. So we have a equipment called a Belmont that we hook up and can rapidly infuse blood products to help them stabilize blood pressure.
You know, really appreciative of those individuals that have taken the extra time to learn that piece of equipment, learn the complicated process of checking and verifying blood, how to set up and operate that machine quickly and safely administer those products in a rapid fashion. And I think it's probably the best I've seen anywhere that I've practiced in terms of how speedily that happens.
I think just understanding the process of the transfusion, there's an algorithm that goes to it, understanding what that is, and then also looking at, you know, what is needed as far as transfusion, the amount that's needed to stabilize this patient.
We have everything set up to promote patient privacy, creating individual discharge rooms so that patients can have their family members back here at their bedside. And with the technology, we have new advanced monitoring capabilities so that we can keep a better eye on the patients, even if we're not directly in the private rooms with them.
It's nice to have the central monitoring so we can see the patient even when we're not in the room. If they're in there just resting or speaking with a family member, we're able to see and capture any abnormalities that they may have.
We are extremely dedicated to education. As a nurse, that's what you want, is someone that is going to help you further your education and better your career. And our team is actually nationally recognized for being highly board certified. We strongly encouraged our staff to become board certified. And many of our staff are not only board certified in one field of perianesthesia, but both of the fields, which is phenomenal. Having national recognition for having that high of a percentage of staff being board certified for this small of a hospital, it's unheard of.
The health system here is very supportive, from administration to education to directors, working together to really just provide the patient's needs.
I love our patients here. That sense of community, and they're the people you bump into when you're out at Fred Meyer's. These are the people in our community, and we actually get to know them very well. And most days of the week, it feels like at least one of our nursing staff knows someone that's coming in for surgery.
I love our new facility. I love the coworkers that I am able to, see every day. The patients are absolutely amazing. The surgeons are top-notch, and anesthesia is amazing.